Well, the incision point is based distally, distal to the A1 pulley, where many procedures for trigger finger release are based proximally. The reason we do it distally is for several reasons. The first reason is because you can find the tendon sheath very easily distally, and we make this incision just proximal to the proximal finger crease. We're able to very easily slide our instrument in up and underneath the A1 pulley from that position. And it's very comfortable for the patient. If you could imagine coming from this direction while a patient's awake and standing over them to do the procedure, it's kind of difficult and awkward. So I designed the procedure so it would be more amenable to do in an office setting. And so it's a distally based incision. It also allows you to release the A2 pulley if there's still a little bit of residual triggering through that small incision. But it prevents you from releasing too much of the A2 pulley, which could be detrimental to the patient in some situations.
It allows you to keep the incision in a fairly fleshy part of the hand. There's a lot of motion in that hand. It doesn't scar particularly severely in that location. And from a cosmetic standpoint, the incision is much more cosmetic without the abundant scar tissue that forms when you get near the palmar fascia. At that level, the palmar fascia is pretty superficial, just inserts really pretty much into the skin, and it makes it a very easy dissection. Patients seem to have quite a bit less scarring in the first even 3 months or so after the trigger tome technique with the distal incision compared to, say, a proximal incision that we do with a conventional trigger finger.